Wow. The hormone testosterone has a lot of controversy when it comes to women's health. I mean, there's a ton of information out there if your testosterone is high. But what happens if your testosterone is low? And it turns out low testosterone can kind of occur at any age. And you don't have to be menopausal. Unfortunately, plenty of women in their 30s who already have low testosterone. But is going through menopause automatically mean your testosterone is going to drop lower? Well, let's talk about it. Today, I want to talk about the five top reasons that I see testosterone drop in women. I want to talk about where testosterone is made, what it does in the body, and testing, because I think a lot of this gets really confusing. Hi, my name is Dr. Carrie Jones. You're going to want to hit that subscribe button because I know hormones like testosterone can feel like herding cats, and I am here to help. So let's dive in. First of all, what does testosterone do? Where is it made? And how do you test it? Number one, it helps symptoms such as muscle building, like lean muscle mass. It helps prevent bone loss. It plays a role in preventing osteoporosis and osteopenia. So it's great for bone strength. Helpful for mood. Women tend to feel more motivated, more confident if they have healthy levels of testosterone. And of course, it plays a role in libido, which is your sex drive. Now, it's not the only hormone involved in libido. Don't think automatically that if your testosterone goes up, you're naturally going to be the same libido you had maybe in your, teens or 20s, so to speak. Now, what about testing testosterone? Well, testosterone in a blood draw, you want to make sure you get what we call like all of it, the gamut, the list. You want to get total testosterone, you want to get free testosterone, and you want to get another marker called SHBG or sex hormone binding globulin. You want to look at all of that. Total tells you the kind of everything, like what's your potential, because this is all the testosterone bound up and the testosterone that's free. Then you want to look at the free marker because that's what's actually free and available. That's what's going around, binding to receptors, doing the thing. Unless you don't have it, then it's not going around binding to receptors or doing the thing. And then SHBG, sex hormone binding globulin, is one of the proteins that testosterone can bind to. The higher the level of your SHBG, the lower the level of your free testosterone. So high SHBG, low free testosterone. So now that we understand what it does and how do you test it, well, where do you make it? Women make it in three different places. We make it in our ovaries. It's actually made in the outer layer of cells on the follicles. They're called the theca cells. I think theca, like THECA, T for testosterone. That's where women make some of it. We can also make testosterone in our adrenal glands and in a layer of our adrenal glands, yes, our stress hormone gland, we do make some testosterone. But the majority of testosterone that's out in circulation is actually made out in circulation. It is converted from a hormone known as androstenedione. So some in the ovaries, some in the adrenals, and the rest of it, like you can just make it out. We call it the peripheral tissue. Just out and about. When you need some testosterone here, there, and yonder, the body will do this conversion from androstenedione and make testosterone. Now, the thing about testosterone is that it might decline with age, but it's not guaranteed. Oftentimes, we think women like, oh, once they become menopausal, their testosterone just naturally drops. So, sort of. Yes, testosterone can decline with age, but you will notice that some women have no issue with any of these symptoms as they do get older. Their libido stays really good, their bone strength is really good, their mood is good, and we test their testosterone and it holds pretty well. It stays in the green when we're doing lab testing through a lot of the decades of their life. Other women, it completely plummets out. They hit their 30s or 40s and whoop, down it goes. It just completely drops. So, yes, it might decline with age, but it doesn't seem to happen at the same rate for every person. And you would also think that for women going through the perimenopausal transition, therefore the change in all of their ovaries and the hormone production that comes out of them, that the testosterone would naturally decline. And it turns out, yes, for some women, because you're missing that portion, meaning once the ovaries are done, the theca cells are done, they've closed up shop, they're not producing androgens like testosterone like they used to, but it's not the case for all women. I absolutely have postmenopausal women who don't supplement with testosterone and still have pretty decent levels of testosterone. Now, I'm not saying this so you can compare yourself or you can think, oh my gosh, Unfortunately, that's not me. My levels are low. Why couldn't I have had that? It just seems there's a lot of factors that go into testosterone. It's more complicated, I think, than we like to think. So let's take a step back. How can we have low levels of testosterone? Well, I'm going to cover my top 5 ways that I see over and over. And this is independent. This is separate from if you've had your ovaries removed. So if you've had a full, complete hysterectomy and you're like, Carrie, I had a hysterectomy. That's the obvious reason. Yeah, of course. Absolutely. So we're taking that out of the top 5 because I realize not everybody's had a complete hysterectomy, meaning like the ovaries, they haven't had their ovaries removed. So if you have had your ovaries removed, even one ovary, and your testosterone plummeted soon thereafter, there you've got your reason. But let's go into the other top 5 that I see. So number 1, medications. Certain medications will drop testosterone levels. These medications can include steroid hormones. So let's say you get an injection for your joint. You are on high dose steroids because of an autoimmune. You are on high dose steroids because of an illness. You can also have decline in testosterone with opioid pain medication. Now, you may have had a surgery and been given opioid pain medication. If you test soon thereafter, you may find that your testosterone's lower than you expected. If you continue to take opioids, even let's say you pop opioids a couple times a week for pain, that lingering back thing, migraines, whatever it is, opioids are your pain medication of choice, do know that can negatively impact your hormones. I also see a drop of testosterone, of course, with the birth control pill. The birth control pill can increase that binding protein that I mentioned earlier called SHBG, sex hormone binding globulin. The more of that you have, the less testosterone you have. So the birth control pill can drop testosterone in some women. And I would say a lot of women, not just a small percent. I tend to see that a lot. So that's the first one, medication. Number 2, chronic stress. Chronic stress over time, big stressors that have lasted months, maybe even years, chronic illness, chronic inflammation, like chronic on the body impacts the adrenal gland. And where did I say some of your testosterone is produced? In the adrenal gland. So it's definitely possible if you have just been going through it. If you have been going through the ringer and you have been told maybe your cortisol is low, you're feeling really burned out, you're depleted, and your testosterone is low, it's the same gland that's making some of your testosterone, that's making your cortisol. So that can absolutely go hand in hand. So number 2 reason, how has your stress been? And have you had any reprieve? Have you been able to take care of yourself? Have you been able to, like empty the bucket, so to speak, knock things off your plate? Because if the answer is a resounding no, Carrie, not in years, then that can contribute to the decline in testosterone. That leads me to number 3. Number 3 are that some environmental toxicants have been linked to low testosterone. We see this a lot in the male studies, and I'm fully aware women are not small men, but we're starting to see more studies come out on women as well. So we've known for a while that things like plastics, like heavy metals, mercury, cadmium, etc., that can deplete testosterone or suppress testosterone in men. But we're also starting to see it in women. So if you're exposed to a lot of plastics in your life, you drink out of plastic water bottles, you're using plastic wrap, a lot of synthetic fragrance, which can be an issue with the endocrine system. So you've got perfumes and candles and plugins and trees hanging off your car. If you have been exposed to mercury, you have mercury exposure, cadmium exposure for some reason, these all can actually be linked to low testosterone production. So it is important that you get that evaluated and can work that up. You probably hear all the time now about the microplastics and the nanoplastics. I mean, that is making our mainstream media because of the amount of research that's coming out about it. So switching to the glass, switching to the stainless steel, being really mindful about the kind of fragrance that you use around your house, in your detergent, on your lotions. Are you burning candles? Like some of these things, we can't get rid of all of it. Plastic is 100% a part of our daily life. There's nothing we can do. But what can we minimize? Like the biggest input to our body is. If you are a 100% plastic water bottle drinker, if you put plastic cling wrap on absolutely everything, if you're heating things up in plastic, just be mindful that might be contributing according to the research. Number 4, Hashimoto's or hypothyroidism. There's in fact a 2024 journal, the Journal of Affective Disorders, and they found that people who had hypothyroidism had an increased risk. There's a causal relationship between the low thyroid and the low testosterone. Now, Hashimoto's is the autoimmune condition for hypothyroidism. Maybe you have what we call regular old plain old hypothyroidism and haven't been told you have Hashimoto's, or maybe you've had this for a very long time. You've been struggling with working through Hashimoto's hypothyroidism and your testosterone is low. It turns out it's possible they go hand in hand. There's a causal relationship. I would actually argue thyroid plays a role in everything. So that didn't surprise me at all that somebody who is struggling with their thyroid, it's not being managed very well, or it's sort of going up and down all the time. You're having all these symptoms, you're having to kind of micro adjust your medication all the time. You may notice that until you find the sweet spot for where you're supposed to be and like the reason you have hypothyroidism or how to work with your hypothyroidism, that it's going to impact other hormones, testosterone included. But I would argue other autoimmune, remember Hashimoto's is autoimmune. I would argue other autoimmune, especially very inflammatory type autoimmune, probably takes a toll on all the hormones as well, including testosterone. So if you have been in the throes of autoimmune disease that is just causing so many symptoms and you're trying to work on it, and as a byproduct, you're like, yes, and my testosterone's low. I would imagine they go hand in hand. There's a huge contributing factor there. So definitely know that autoimmune in general, because how it plays in inflammation in the immune system, can impact testosterone. But then specifically, hypothyroidism seems to have a causal relationship with dropping testosterone. If the hypothyroidism, let's say you're still trying to figure it out, you're not quite on the right path for that one. And that leads me to number 5. What is number 5? Number 5 is infection. Now, I did talk about that a bit with the autoimmune, if you're like in the midst of like inflammation and whatnot, but infection might be different. If you are in the midst of infection, let's say you're working through mold, you're working through Lyme, you're working through long COVID, you're working through any type of sort of long-term really affecting you type infection, again, that's going to impact inflammation, it's going to impact your immune system, and that can drop testosterone. It can lower testosterone. So don't beat yourself up if you're like, oh my gosh, this is me. I live in a moldy house. I am actively working on remediation for this and getting the mold out of my body, or Lyme disease, or long COVID, or Epstein-Barr, or any other kind of like long active infection that's really impacting you. It definitely could be the reason for your low testosterone. So I hope this is helpful in understanding the 5 reasons that I see testosterone drop besides surgery, maybe besides age. We mentioned that for some women, testosterone does drop with age, and others it's not as fast, it's not as quick. But if you're that person who's like, I am not menopausal yet, and yeah, my testosterone dropped in my 30s, what's going on? Or maybe you hit your 40s and it just completely like the rug was pulled out from under you. There goes your testosterone. Let's look at some of these other factors and what's going on. You now understand lab testing, which ones to ask for when you're getting your blood draw. You understand where it's made. So maybe there's issues in those glands. And then, of course, what symptoms to look out for. So testosterone, I don't understand why it's so controversial, why it's so awkward to talk about it in women's health. It is a very important hormone that we have in the female body. So I'm putting it all out there. We're doing testosterone education here, and I want you to have this information at your fingertips. So I hope that this was helpful. Again, I am Dr. Carrie Jones. Hit that subscribe button. As I said, hormones like testosterone can feel like herding cats, and I am here to help.